Brandon is 18, small for his age, profoundly retarded, with a history of seizures. Nearly 24 hours a day, he wears 5 electrodes on his body and always has a therapist at his side, ready with remote controls to give him skin shocks if gentler ways of stopping his self-abuse fail. By age 13, Brandon had bitten off part of his tongue, chewed his inner cheeks, and dropped to 52 pounds. In a desperate attempt to save him, psychologists at the Behavior Research Institute in Rhode Island used the only device then available to give him more than 5,000 mild electric pulses in one day. It had no effect. So BRI developed its own shocker, strong enough to grab anyone's attention. The burning sensation is brief and felt only in one spot, leaving no permanent mark or injury. Within 5 weeks after Brandon first received the stronger shocks, he gained about 20 pounds.
If this treatment were taken away, I don't think I could keep Brandon alive.
Matthew Israel's aversive therapy methods have been challenged before. Now, officials in Massachusetts, where students are bused to group homes, want to decertify the program, effectively ending the skin shock therapy.
It can never be justified to abuse another person like this, no matter what the situation is.
Parents of students at the Institute resent such comments.
Nobody really knows what it's like unless they've lived it.
Susan Phelan lived it for 17 years with her son Terry, retarded with cerebral palsy. He beat his head to the point of losing sight in his right eye and went partially blind in the left. After he came to BRI 3 years ago, skin shock stopped the self-abuse long enough for doctors to discover and treat his chronic ear infections.
My son is very happy here. I feel safe because he is watched 24 hours a day. I don't feel it's invading any of his rights to privacy.
Phyllis and James Shields also approve of skin shocks.
It's quick, and it's over with, and it's effective. Right. It's much better than having a helmet on your, that's more inhumane.
The Shields' son, Michael, used to wear a helmet for weeks on end. Now, at age 30, wearing the shock devices, he earns money assembling jewelry. His classmates include Wayne, who used to eat corkboard, cram his mouth with food, and commit other acts of self-abuse too gruesome to describe. On this day, Wayne's supervisor hadn't given him a shock, but said she would if warranted under strict guidelines.
The consequences are so less severe than the damage that they can do to themselves without this.
2 students capable of conversing told us the skin shocks have helped.
I'm not acting out like I did before.
Bad boy, they got stop. Be good. Stop no more.
Matthew Israel says his program gives students far more rewards than punishments and discontinues shocks when possible. He believes many other programs use aversive methods, but under politically correct terms.
I couldn't live with myself, I suppose, if I played those games.
So he's going back to court to fight for a treatment he's convinced gave new life to patients no one else could help. Brian Jenkins, CNN, Providence, Rhode Island.